All right. Well, good afternoon, everybody, and welcome to our Compliance Foundations webinar series. This is session number 4 of our compliance series that we've been working through with SimiTree and CHAP. My name is Deb Grott. I'm the VP of Clinical Compliance at SimiTree, and I also have Lori Newland and Kim Skian co-presenting with me. Today, we're going to do the deep dive into the compliance program, elements 6 and 7. And I just have a couple of housekeeping items that I want to go through first as we get started. Part of that is we want to talk about the Q&A, so we'll be using the Q&A panel only. So at the top, there's a Q&A panel that you can put your questions in there, and we will address the questions at the end of the presentation as long as we have time to get through them. The handouts are linked in the chat, so you should be able to get to the handouts in the chat session. At the end, to receive your certification, you need to scan the QR code. Once we get to that screen, there'll be a QR code for today's session, and you'll complete a brief survey in order to get your certificate. And then keep in mind that all previous sessions are available on demand on the CHAP YouTube channel. So we want to make sure that everybody understands that. So if you missed a couple of sessions, you can go back to that CHAP YouTube channel and catch up on those. So now we're going to get ready and jump right in. So Lori, I'll have you switch to the agenda. Talk a little bit about the agenda. We're going to talk about elements 6 and 7 of the OIG compliance program today. That encompasses the risk assessment, auditing and monitoring practices, responding to detected offenses, developing corrective action initiatives and plans. CHAP is going to review the compliance standards in relation to the OIG 7 elements. We're going to talk about general strategies and resources that can be used organization-wide and how they align with the OIG 7 elements of the compliance program. And then we're going to do a wrap-up and a Q&A session. So it's great to be here with you all, and we're going to dive right in. And I think Lori's going to take it away.
Yes, thank you so much. This afternoon, we're going to start out by talking, and we're going to really do a little deeper dive into elements that have to do with developing your corporate compliance plan, internal auditing and monitoring, and investigations. We specifically took this out of the typical order so that we could spend a little more time on these pieces. Remember that if you have questions, put them in the Q&A, and we will answer those at the end of the session. When you're conducting an internal monitoring and auditing process, it's really important to remember that the goals of a compliance risk assessment, and especially in recent years as the OIG, the compliance community and other stakeholders have come to recognize and place increasing emphasis on the importance of a formal risk assessment within your organization to really show that you're doing a deep dive and that you're processing and looking at compliance within your organization. As a part of this, the compliance program, the goals, along with an evaluation, include an objective, measurable goals, evaluation of new areas of high risk or problem-prone areas within your organization, based upon both internal and external evaluation. And we will get more into depth in that and what the differences are in just a little bit. We want to establish ongoing or new key performance indicators while generally referring to in interchangeable terms. Auditing and monitoring are actually processes that typically take place in tandem. And we're going to talk about the difference between those two processes. The primary defining characteristics of the two processes are typically differentiated by an external versus an internal review process. A compliance risk assessment is a risk assessment process that looks at risk to the organization stemming from violations of law, regulation, or other legal requirements. And it's a routine monitoring or ongoing risk, plus the capacity to monitor the effectiveness of controls and risk remediation. And it's part of the compliance officer's responsibilities and you have a when you have a written compliance program. Now, not all organizations have one, and as of yet, those have been elective processes. But if you are interested in developing one and you want to be sure that you really have a full functioning compliance program within your organization, you want to be sure that you have assign someone as that role of compliance officer who has the responsibility for this written compliance program. Entities may identify other areas of appropriate for routine monitoring based on this risk assessment and their interaction with the federal healthcare programs, such as medical record documentation, medical necessity of admission, or business needs justified for contracts from referral sources. So when you're doing auditing, this represents the evaluation of activities completed by individuals that are independent of the area being reviewed. So it's either someone from outside the organization or someone who's not, for instance, in the department that's being reviewed. It's an external process. And this is done periodically, while monitoring represents an evaluation activity that's completed internally. So an organization within a specific department will monitor themselves, while the auditing process is done by someone else to see what's happening within that department. So those are two very definite distinctions between auditing and monitoring, and they're very important to understand. And so when you hear someone talking about auditing, you want to remember that that's an external process and your monitoring is an internal process. Auditing should thereby be provided by a more objective assessment. And per the Healthcare Compliance Association, if you listen to or participate in any of their information related to development of compliance program, you'll hear them use these definitions as the part of the process when you're developing your compliance program. So when we look at auditing, we typically look at characteristics of an audit, which include the following: formal review governed by professional standards. It's completed by professionals independently of the operation. It has a formal, systematic, and structured approach. It involves planning, sampling, testing, and then validating the items that you're reviewing. It has a formal communication with recommendations and corrective action measures. It's documented follow-up of those corrective actions. And the audit accountability is typically assigned to a chief audit executive, an audit committee, a compliance officer, someone who has that formal role within the organization. And then it involves routine formal communications to the board and to management. And once again, when you look at the regulations and the outlines utilized by the Healthcare Compliance Association, auditing is a systematic, formal process, which is a disciplined approach. It's designed to evaluate and improve effectiveness of processes and related controls. So when you're developing an audit process within your organization, the goal is to have a formalized process in place that you can show effective measurements within your organization. The auditing is governed by professional standards. It's completed by individuals who are independent of the process or independent of the organization, but certainly independent of the department or area that you're looking at. It's normally performed by individuals with one of several acknowledged certification. It has objectivity in governance, and the reporting is the benefit of independence. So you can show that the people who did the audit within the organization were independent of the area that was being audited. And so that gives you objectivity within the organization when you look at those audited items. When we go on to look at monitoring, this is that internal process that's utilized within the organization. The typical characteristics of monitoring efforts include the following. Usually they are completed by operations or compliance personnel, so they're done within the organization. They may be done within a department or by someone who works with that department to monitor areas of importance within that department. They involve ongoing checking and measuring. So this is a continuous process. It could be that it happens over a long period of time, or it may be short. If there are small things that you want to see that you've really hardwired change within your organization. Can be periodic spot checks. It could be weekly, daily, monthly. It may identify the need for an audit. So you may put something in place, and that may be your reasoning as to why you feel like you need an audit in place, that you monitored within your organization, you saw that this was a high-risk, problem-prone area, and therefore you felt like you need an external monitor to come in and look at how you're doing it with interventions that you've put in place to make improvement. It has accountability for monitoring. That's typically to an operational leadership. So it might be a department manager. It might be a VP over a certain area of the organization. It's typically completed by departmental staff and communicated to departmental management. So you might have, for instance, a QAPI audit group who looks at your internal monitoring, and they may be ones who really do spot checks for you, or you may have folks within your own department, sometimes nursing, for instance, in most organizations, will do some kind of their own internal monitoring. It's completed in relation to a compliance work plan. So you're looking at areas that to determine whether they need to be a part of the overall compliance work plan. It has formal communication to the chief compliance officer and the compliance committee, and it may involve internal audit or compliance. And when you go on to look at the information that the Healthcare Association has provided to us, Healthcare Compliance Association, monitoring is kind of that ongoing process. It's usually directed by management. So management may be the ones who say, this is a high-risk area within our organization. We really need to emphasize this. We need to do some internal monitoring so that we can determine how prevalent this is, how high a risk it is within our organization. Monitoring is an effective detective to control within the process, and it's often less structured than what we see with a auditing process that happens. And auditing techniques may be utilized as a part of this monitoring, but it may not be quite as structured. Generally, those who are doing monitoring within an organization also understand the information that they're looking at more closely than an auditor would. So there's less objectivity that happens during the monitoring process. When we look at auditing versus monitoring, this was enacted because of Sarbanes-Oxley legislation. So if you will recall, back in 2002, there were some times when there were some major issues with large organizations such as Enron and WorldCom, where they found that because they lacked internal controls, they had ongoing issues that really developed to the level of a scandal within those organizations and nationwide. And as a result of those weaknesses in corporate governance and financial reporting, there were specific auditing terms and processes that were put in place as a part of this legislation. And those have specific meaning. When we look at improper, inaccurate assumptions, these may be in regard to the type of work conducted and reliability of results. So to be named an audit, the activity should have been completed by an internal audit or an external independent party with reporting responsibilities to the CEO or the board. In this regard, the compliance audit activities are completed at the direction of the compliance officer or a privacy officer that are reporting to the CEO or the board. Many times that's part of the reason you see that your compliance officer has joint reporting responsibilities to the board and to the CEO, is because they also need to have an outlet outside of the organization where they can share information. If there are findings who involve, for instance, the C-suite, they're able to take those to another entity and have some monitoring tools and processes in place to be able to evaluate that. Management uses these monitoring tools and processes to verify that the controls are implemented and working on a routine basis, and that business risks are being identified and addressed. However, because management is checking on their own operations, a conflict is evident within this process and may reflect what management refers to as reporting instead of actual results of an audit. Also, in many respects, operational personnel have better understanding of the data, and therefore their monitoring tools may be different than those that you would see used as a part of an audit process. These tools are not necessarily tempered by objectivity or perspectives of knowledge of an experienced auditor who would put in place detailed professional auditing processes. So once again, when we look at this auditing versus monitoring process, this monitoring and all other activities that support management efforts to ensure compliance includes certain activities completed as part of the compliance work plan and should be labeled as such, that these are going to be monitoring processes within the organization. And this joint concept, which was introduced as a part of the federal sentencing guidelines and related to the Office of Inspector General's compliance program guidance, many organizations also have internal auditing departments, most of which are predicated as a part of the formal compliance program. This lacks the guidance that can create confusion among employees and management. So when you're talking about auditing versus monitoring, you want to be sure that there is an understanding of these two different terms and what they mean differently one from another. And that goes back to that internal process versus the external process. When you talk to a board, you want to be sure that you're talking about these processes separately, because many times they get used interchangeably, and that becomes very confusing to folks. You separate those definitions, and the term uses will minimize, if not reduce, that confusion. The fifth requirement of the federal sentencing guidelines is this existence of an auditing process. And so when we're looking at an auditing and monitoring reporting system, it's designed to detect criminal or non-compliant conduct. Even with recent issues in the amendment of these guidelines, specific requirements for auditing and monitoring were not specifically required as a part of that. So when we look at the intersection of this auditing and monitoring process, both benefit one another. Auditors can use the results of a monitoring effort to identify risk, reduce audit duration or frequency, and or focus more audit efforts in other areas. So both of these processes should be utilized when developing a compliance risk assessment. It's important to develop a methodology for warehousing all your auditing and monitoring data and initiatives over time to allow for easy retrieval. You should be able to go back and substantiate this information. And if there ever was an external investigation who wanted to look at your compliance program, it's important that you're able to pull this information out. Both auditing and monitoring have the goals of hardwiring change within your organization. And when change is embedded in the organization can then move on with other areas of concerns for noncompliance. So this monitoring mechanism can be driven and or validated by audit tests and results. So you want to be sure that when you look at the process, you're able to validate the information that's provided, ensure that you're utilizing not only past information, maybe as your area to develop why you utilize this as an area of risk, but also current information. And the monitoring methodologies can be reviewed by your audit department to ensure that there's consistent approach for documentation, efforts, and results, and the report of the findings. It's important that you use consistency in the information, that not only you're looking at it from a consistent standpoint, but you're also reporting it that way as well. So when we're developing a risk assessment as a part of our compliance program, it's really a systematic approach that will prioritize our risk. So it will look at things that were high risk, problem prone areas, and why you made a determination based on your review that these were the areas that were of highest risk, and that they really needed the emphasis by your compliance department to be the items that were a part of your risk assessment. That doesn't mean you're not going to have other areas of risk. You will, but they may not rise to the same level as the areas that you made a part of your formalized risk assessment. You want to define the scope and align with regulatory requirements, and you want to be sure that your data collection mechanisms are consistent as you look at information. So as I was looking into various pieces of information around developing compliance risk assessments, it's really interesting when you go to Google this information, how much information is available. There's lots of folks who are in this space, and I ran across one who's really a well-known YouTuber and an attorney, and that's Aaron Hall. And he's a business attorney who really talks a lot about compliance risk. And what he had to say was that developing a compliance risk assessment requires a systemic approach that identifies, evaluates, and prioritizes potential risks within an organization. So those potential risks could be based on regulatory requirements. They could be based on your own organization's review of your data. They could be based upon national trends, but they're based on some kind of an organized process that you made a determination and you measured against. The initial step involves defining the scope and objectives and ensuring that alignment with regulatory requirements and internal policies are present. So you want some kind of a measurement that is objective that you're going to be measuring against. And then the comprehensive data collection follows sort of this encompassing regulatory framework. It has past incidents, it may have operational processes, and it's critical to this phase that shareholders are also involved. So different shareholders within or stakeholders within the organizations, or maybe even externally to the organization, who can be one-time members of your compliance your compliance team, bring forth their expertise as a part of this. So that's why we make up the compliance committee of folks throughout the organization who really bring separate areas of expertise forward, and they can help us make a determination on why areas are important, what level of risk they rise to, and how we should categorize those as a part of our compliance risk assessment. These folks help us secure insight from diverse departments to capture varied risk and perspectives. And then they help us identify risks and analyze what's occurring and categorize those risks based on the likelihood of the impact within our organization or overall. So in home health and hospice and many other healthcare entities, we use things like the Pepper Report, or we may have outside organizations such as SHP, or we may use areas where we've seen our MACs put out information that says these are high-risk areas. Those are analytic areas that we can look at our information and utilize the expertise of our stakeholders within our organization, past incidents, our internal either current or past data collection and data analytics to determine what the scope and the risk level is within our organization. And then we want to be sure that we use data analytics. So as we've grown and as we've become more computer literate and used EMRs and those type things, data analytics has become even more important, that we're pulling that data out and we're really utilizing it, that we're not just collecting data for the sake of collection, but that we're actually utilizing that data to measure the effectiveness of our organizations. And as well as the real-time data review, the risk monitoring helps to identify trends and areas of concern effectively within our organization. So when we continue on with our risk assessment, Mr. Hall goes on to state that understanding the compliance requirements and conducting internal audits and assessments of gaps and analysis in historical data and evaluating and utilizing feedback, comparing performance against industry standards, and mapping out your risk by having an action plan which weighs the severity of risk, impact, and likelihood, and really prioritizes major risk with responses that include mitigation of our risk strategies are important. And that's really one of the key elements when you're developing a risk assessment, is that you're trying to determine where your high risk areas are. You're measuring those against external elements or internal past history within your organization. You're identifying the risk. You're assessing the outcomes of noncompliance. What's going to be the penalty of noncompliance? Is this a law? Is this a regulation? What have we seen based on other things that we've read or we've seen, or the OIG or the DOJ has published? Their reports are really good sources of information to make a determination on how big the risk is for noncompliance. We want to prioritize those risks. Some folks do that with a number system. Sometimes people use a color code like a red, yellow, green to determine which things are at higher risk within an organization. And that's really how they kind of prioritize what they're going to address and at what level they're going to address that. Also, when you're addressing those, which ones are most important? Which ones are we going to address first? And then they strategize to validate those results. They look at how they're going to determine their internal monitoring system, whether they need an external audit to come in and validate that information as a part of their formalized compliance process, and then how they're going to internally go on and monitor in the future with this information. You want to be sure that you really hardwire that change so that you're not having to go back and redo this monitoring over and over again. It really wants to make an impact for change. Now, that doesn't mean that you'll never go back and look at it again. You do want some kind of an internal random check of information to make sure you're still maintaining the levels of compliance that you set for yourselves, but you shouldn't have to have this be an ongoing forever monitoring process. And once you've implemented your strategies, you want to evaluate those results. You want to kind of think of a care plan within your organization. And when we develop a care plan, we look at what our problems are, and then we say, okay, so here's my problem. I'm going to determine what my highest risk areas are, and then I'm going to prioritize my interventions. And based upon the risks, then I'm going to put interventions in place and implement my interventions and measure my results. And all these processes will help to improve our organization so that we can maintain compliance within the organization and ensure that our processes were effective. Now, when we use this data analytics, it's become really an important piece of the process when you're establishing an effective risk assessment. Data analytics efforts may range from simple to complex depending on the entity's volume or the size of your data, or maybe the type of services you provide within your organization. Of course, an organization that is small, that only provides one line of service, their data analytics aren't going to be nearly as complex as someone who's very large, maybe a national organization, who really provides several lines of service, and they're really gathering a lot of data. Because of that, you're going to have larger entities will have a more complex process in place to utilize that data analytics, to store it, to be able to look at it and look at the size of those entities and the data that's generated. Do they need third-party entities involved? And should they be able to compare standards and metrics of their own healthcare operations internally and determine whether they are outliers or whether they are in line with what maybe national standards are, or things that we see in issues like PEPR reports, and we should be able to compare those both historically as well as to current data. Between compliance risk assessments, and it's important that the compliance officer should continue to scan for unidentified or new risk. Our risks are always changing. We're always going to have new risks in place. The risk may modify. We may see that something that we thought was very simple at one point in time, now there's new guidance on that, and it's become much more complex. I know we've all probably seen that within our organizations. I'll just use hospice, for example. In 2020, we had some new hospice requirements put in place for our notice of election. Initially, we all thought, oh, we've got this down. And now through TPE and processes such as that, we've seen that it's become more of a complex issue. There have been more denials around those things. And so we've seen that we needed to go back and look at it. If, for instance, if we had paper notice of elections in place at that time, and we still are utilizing those, it's much more complex to collect all that paper data versus when we only have one internal electronic process in place. And so your compliance officer is really looking at all the things that feed into that could put us at a high risk, that produce ongoing risk within our organization. We want to monitor for those legal and regulatory changes as we receive more guidance on them. We want to be sure that we look again to make sure we're meeting all the guidance requirements. We look at enforcement actions that have happened. We look at the OIG work plan developments, and then new entity acquisitions. So if you are an organization who is acquiring other organizations or looking at a mergers and acquisition process, you know that just because you've seen one notice of election, you've seen one notice of election. Every entity may have those formatted a little differently. They may have worded things differently. And so you want to look at all the pieces within that organization and have a strategy or initiatives in place to evaluate and investigate the results that you find and the information that's in place. Deb, do you have something to add to this?
Well, I want to talk about auditing, which is really near and dear to my heart. I do a lot of this every single day. So auditing is probably one of the most important pieces that you can do for your organization. So Medicare requires, as a condition of payment, that items and services be medically reasonably necessary. So that means entities should ensure that any claim reviews and audits include the review of medical necessity of the item or service by appropriate credentialed clinician. So what we mean by that is, you will hear organizations say that they do a pre-bill audit. A pre-bill audit can mean a lot of things to a lot of people. A lot of times a pre-bill audit means that your billing department is looking to see that you have the appropriate pieces, the signed orders, all of the clinical notes are in for that period, the face-to-faces or the required technical pieces are there, the check boxes are there, and that means it's ready to bill. The version of pre-bill audit you really should think about within your organization is that deep dive, right? That 30-day look at that, or 1 month look, 30-day look in home health or hospice to ensure that your clinicians and your physicians in hospice or nurse practitioners are documenting to support the medical necessity and skilled need. So in hospice, you're looking to ensure that that patient is meeting the terminal trajectory of 6 months or less, that the face-to-faces or narratives that the physicians or nurse practitioners are documenting support that, and your clinical documentation supports that as well. In home health, you're looking to make sure that your documentation supports the skilled need that you're providing and that there's medical necessity. We get caught up a lot of times in those things where, you're going out there and you're putting, in home health, we're putting bacitracin and a Band-Aid on something because somebody can't reach that part of their leg or their foot. And that really doesn't meet the skilled criteria for that. So when you conduct pre-bill audits at a deeper level in your agency, and that can be part of, your ongoing monitoring process for your QA. If you have QA people that, they could do a percentage of your pre-bill audits each month. You can do that as also a part of your QAPI program, but really it needs to be more often than your QAPI program. But that will allow you to ensure that your documentation supports those payments of condition for Medicare. You want to identify the billing and payment issues that are under scrutiny and develop a plan. So I suggest looking at those MACs, NGS, CGS, Palmetto, seeing what the latest and greatest denials are, get out there and take a look at what the activities are, what the focused audits are, because everybody, whether you're in home health, hospice, you're going to be subjected to a TPE. And so you want to know what that scrutiny is so you can hone your auditing processes to ensure that you're looking for those focus areas that are going on. Currently, we're seeing a lot of long length of stay audits. So whether you're in home health or hospice, you need to make sure that your long length of stays are being audited. And in hospice, we used to look at things in a benefit period, right? We're looking at a benefit period. Now, CMS is really looking at things month to month to month. So they may look at a benefit period, but they may deny you on 1 month or 2 months or 3 months of that benefit period because those months don't really meet that medical necessity, skilled need, terminal trajectory of your patient. So it's really important that you're looking month over month at these audits that you're doing. Developing a quarterly or annual audit plan for oversight and to focus on identified problem areas, remembering that you can, turn those into some of your QAPI plans, but Also remembering that compliance and QAPI activities may be different. Compliance looks more, on a global basis and looking at identifying those problems where your QAPI plan may develop those plans of correction and plans of auditing that you're going to do on an ongoing basis. So you've got to remember that compliance audits and QAPI activity, although they end up at the same place a lot of times, but they really can be totally two different things. Always frequent CMS, OIG, DOJ websites, and use resources such as state national provider associations and industry experts, including counsel, to understand what the latest and greatest things that are going on. For example, if you are in Nevada, Texas, Arizona, or California, there is a PPEO going on in those states, which means it's a period of enhanced oversight for people who are new to the industry of hospice. You've opened a new agency, you've bought a new agency, you've changed ownership within that agency, and you're subjected to that PPEO. So it's important to understand what that means for your organization as well, and understanding that the targeted probe and educate is still going on. Then you have those work plans from the OIG and the DOJ that are important as well. You want to understand what's always going on out there within these auditing organizations. Utilize your MAC and the survey readiness audit tool. So your MAC has wonderful resources in there, whether that's educational resources, audit tool resources, how to put your ADR packets together, things like that. Go ahead and utilize those MAC websites to indicate and review that education that they're providing related to your auditing practices. And then ensuring implementation of reporting and follow-up processes in accordance with your organization's policies, compliance, and HIPAA program. So remember that when you're doing these auditing processes, and whether that's an external audit or whether that's an internal audit, that your compliance committee, your compliance officer, sometimes your internal counsel will be involved in those things. And you want to make sure that everything that's being implemented is following your organizational policies that you have within your organization, because it's important. When you get something such as a survey, and Kim will touch on this, they're looking at your policies and procedures to ensure that you're following your own practices within your agency. So it's important in your auditing practices to ensure that you're following those internal organizational policies as well. Lori, anything to add on that?
No, one thing I was thinking as you were saying that, in reference to accreditation agencies, while compliance programs are not necessarily mandatory for everyone, if you are a part of an accreditation agency and you're being reviewed by them, they will have compliance standards in place, and Kim will talk about those.
Yeah, absolutely. Absolutely. So on the monitoring aspect, compliance audit and monitoring plans also should contain routine monitoring of ongoing risks, plus the capacity to monitor the effectiveness of controls and risk mitigations. Some of these examples include a lot of HR monitoring. So your monthly screening of your LEIE, which is that list of excluded individuals and entities, OIG checks basically to ensure that the clinicians that you have in your organization are not excluded from providing care under the Medicare benefit. And then the state Medicaid exclusion lists as well. There's regular screenings of state licensure and certification databases. So your HR policy should reflect how often you're monitoring these things and making sure, and your internal monitoring processes should ensure that these are taking place on that policy-driven timeline. So it's important to talk to your HR department and make sure that you do have something in place to monitor these things. Annual review of entities, policies, and procedures. So important. Things change within the regulatory guidance, things change within your organization, and that requires you to review those policies and procedures and make sure that they are up to date with the latest and greatest regulatory guidance that's out there. And remember that when you're annually reviewing these, you should indicate the updated policy date, the most recent updated policy date on that policy, so that you can ensure that you're looking at the most up-to-date policy for that particular thing that you're dealing with. So not all policies will require updates on an annual basis. They do require you to review them, but there are policies that you will update annually, sometimes more than annually if regulations change after you've reviewed your annual policies. Other areas that are appropriate for monitoring include the interaction with your federal healthcare programs, such as medical record documentation, levels of care, length of stay, medical necessity, admission certification, recertification, or business need justification for contracts and referrals. So ensuring that your contracts are being monitored potentially on an annual basis, they're being updated as they're making sure that you're understanding when they're expiring and that you have current contracts for whether that's clinical staff, therapy staff, DME companies, whoever you may have contracts with, understanding and making sure that you have all of that up to date, and making sure that you're monitoring things that are within your medical record to ensure that you are meeting all of the regulatory requirements, billing and otherwise, to meet those levels of care, length of stay, medical necessity, et cetera, et cetera. TPEs right now are really honing in on long length of stays, levels of care. They're honing in on that medical necessity. And if you should really know what's in your charts before you have an opportunity to send an ADR off to your MAC or other requesting entity, whether that's a CERT, a SMRC, or UPIC, because you don't want to get into a situation where you've been requested to submit some type of documentation and you have no idea what to expect within that chart until you look at it at that point. Your auditing and monitoring processes should have already picked up on stop gaps within your records, and you should already know what the outcome of this is going to be before you even open that chart and look at it. That you've either educated, you've found these issues, you've educated, you've monitored to ensure the correction of them, and that when an ADR comes, that you should be confident that it should have no issues going forward. And then short-term monitoring is useful for determining the effectiveness of risk mitigation. So when you're identifying those issues, it's always important to ensure that you're doing a short-term monitor to ensure that your education worked. The things that you found on a risk mitigation audit, you've did that education, you've provided the guidance, and now you're doing that short-term monitoring to ensure that that correctiveness is done going forward. The other thing I like to say is mock surveys are a great and helpful way to monitor your survey readiness. We talk a lot about billing readiness and things like that, but mock surveys are an important way to understand your organization's readiness for survey. And you don't need to do it right before your survey window opens. You want to do that even on an annual basis, because you want to understand that your organization is ready for a surveyor to walk in that door at any time. Remember, they can walk in there for a complaint. Remember, they can walk in there for other justifications other than just your recertification survey. With that, Kim, sounds like you.
Deb, I want to just say really quickly, when
Sure.
it comes to exclusion checking, while we have monthly here, what the regulation says that we're continually responsible to know. Yeah. So for some folks, it's even more frequently than monthly that they're looking at them, but I would say that annually is not frequently enough. And I do hear that on a pretty routine basis that people say my policy says we do it annually. So you want to look at that. And also, especially like within hospice, where we are paying other entities to provide services for us. we also have some responsibility to monitor what those other agencies are doing. So you want to have some kind of a monitoring process in place also for other entities that you utilize to provide your services.
Absolutely.
Well, excellent, everybody. And thank you, Deb. And for the audience, I did not pay Deb to say what I say all the time, which is mock surveys and ongoing survey readiness and everything. So thank you very much for including that in the in your comments.
I learned from the best.
Thank you. I welcome everybody. I am happy that you're here today with us. I will review our CHAP standards, but I also want to comment on a few items that Lori and Deb have presented, just to reiterate. When Lori talked about independent auditing, this is extremely important because often organizations believe that their auditing it takes place internally with the same staff or the direct managers who are reviewing the records and documenting in the records on a daily basis. And you want to make sure that you have a once removed, if you will, or more lens to be able to make sure that whoever is auditing the records is independent in terms of being able to review those the records. Because think about it, we're talking about compliance right now. If it's a survey, our surveyors are our site visitors are your independent reviewers. So you really want to make sure that you have that process in place. And then the second part is, you can see through auditing and monitoring, this is the same process as what you would have in place for QAPI, quality assessment and performance improvement. Yes, the objectives and priorities may be different, or there may be some crossover, but the process of assessing, prioritizing, implementing change, and continuing monitoring and evaluating for improvement is the same across the board. Regarding the compliance program in CP5, which for CHAP is our standard related to compliance, this relates to effective auditing and monitoring. We will look to ensure that you do have an effective auditing and monitoring plan in place. And again, we will review your policies and your processes through document review, through your policy, what the program looks like, the plan, as well as interviewing designated compliance and agency staff regarding your auditing and monitoring activities, and also looking at the evidence of the auditing and the monitoring and how they correlate with your prioritized risks, as well as your response to any response to the findings. In other words, if there's an identified issue or a potential risk that you are addressing that particular risk, as you would, like I said, with a performance improvement project. Some examples, yes, billing for sure, and claims review are significantly important. We talked a couple of sessions ago about the intersection in some areas. So some areas may be related to the plan of care. Is the plan of care, consistent with the needs of the patient? Do we have physician orders? Are they timely in terms of addressing changes in status? Could be survey related, especially if you've had findings at a condition level or, previously, and what has your organization done in terms of correcting those problems and mitigating risk. And then also looking at HR. Deb brought up and Lori about HR file, human resource personnel files. And we will survey, and again, to your policies. So the reason monthly is indicated on this particular presentation is because general program guidance from the OIG does identify monthly as a best practice, but to Lori's point, absolutely it can and should be in some more frequent, if that's what your organization has identified, or less frequent, but certainly not annual in this day and age, is not sufficient. And the reason for that is because if you are audited, and this is not survey, but this is audit, and it's identified that one of your clinicians or practitioners has been on the OIG exclusion list for a period of time, or for example, they're not licensed, they're licensed lapsed, you will then need to, that you're then that's a risk for you, and that's a direct financial, impact on your organization, because those visits that clinician or practitioner performed are not going to meet the federal payment and regulatory requirements. So you do want to make sure that you have that ongoing review. And to Deb's point, or Lori and Deb's point, not just other entities, but individual practitioners. So if you contract for therapists, for home health, or for hospice, you want to make sure that you also review those contracted services as well. Again, we will look to evaluate your compliance and to make sure that what you have identified as priorities and what you've identified in your plan, that you do have an auditing and monitoring process in place. Thanks, everybody. And I don't know, Deb, I think at this point, right, I turn to Lori for OIG Element 7.
So in element 7, we're going to talk for a little bit about detected offenses and undertaking corrective action. Important piece of what we do. So compliance programs should include processes and resources to thoroughly investigate compliance concerns. It's important that we can show that happened. If you've ever had an external reviewer come in because of a complaint or whatever, they want to see as part of your plan of correction that there's been a thorough investigation and things are in place. So it's really important that you take that. And heaven forbid that you should have someone above a surveyor of the OIG or the DOJ come in, or you're under a CIA. They want to be able to see all these things have happened. And so we want to take the steps necessary to remediate any legal or policy violations that are found, including reporting to any governmental program agencies or law enforcement where appropriate, and doing that root cause analysis to identify prioritize and to prevent reoccurrence. That's the most important thing. Yes, we may have to do something. We may have to do reporting. We may have to look at it, but the most important thing is that we can avoid reoccurrence. So when I was looking into this information, I really came across someone who had written a great article regarding compliance investigations, and that was Liza Warner. She's a CPA, and she's talked about the important elements when responding to internal investigations, especially related to regulatory compliance. And when responding to internal investigations, she says, related to regulatory compliance, there are 7 elements that are crucial for effective and compliance handling of this situation. And the first thing is understanding the nature of the inquiry. So sometimes people will say things to us and we don't really understand where they're coming from. So it's important that we ask, what has happened? What's instigated this? Why are you making this inquiry? What all did you find? So that we can be sure that we have a full understanding of what the inquiry is about. By having a good understanding, we can really look into everything that went into that situation occurring. Organizations must have a comprehensive scope when they look at potential violations of an inquiry. They really want to tailor their response accordingly. So when we look at assembling we want to make sure we have a skilled response team. That's those stakeholders who really understand what goes into this process. So if you ask me to go look at a construction site, I would not be an appropriate person to evaluate what meets regulatory requirements in a construction site. So you want to be sure that you have people who have knowledge and understanding of what might have gone into that process. We want to stop that issue from continuing. That's the first thing. We want to make sure that we put stopgap measures in place so that we can stop those things from occurring. And we want to have a dedicated team with legal, compliance, and subject matter experts. And it's essential for coordination in those efforts to be sure that we can have an appropriate investigation. We want to conduct a thorough internal investigation and a review of the process. And this step is really vital for investigating compliance gaps and gathering relevant documentation for a comprehensive analysis. When we look at that information, we want to be sure that we have clear communication with regulators and stakeholders so that we can maintain transparency and professionalism throughout the investigation and have a process that's crucial for maintaining stakeholder confidence within our organization. We want to document what actions we're taking, and we want to keep a record of those that documentation. We want to be meticulous about the documentation of all the communication and actions if it's necessary for accountability and to support compliance and address potential liabilities that may have occurred because of this investigation, this item that we're investigating. We want to develop a proactive public relations strategy if it's something that we have to be concerned about the community knowing about or something that may occur. We want to manage that external communication effectively during this investigation. And it's really key to make sure that our stakeholders maintain confidence in us is what we tell the community and the stakeholders as a part of this process. And we want to focus on these elements. The organization can navigate those complexities really for regulatory scrutiny and respond to internal investigations with a clear and compliant approach. So when we're looking at those governmental programs and agencies or law enforcement, and we're doing that root cause analysis, we really want to keep saying, but what caused this, but what caused this, and move back to what really could have instigated that process. We want to have a concurrent record of the investigation, and this should be maintained so that a record of the investigation can be compiled, no matter who's participating in it. You may have multiple people working on an investigation, and so you want to be able to bring all that information together. So it's important that it's documented, both in the initial investigation process, but also when we look back at the process that we can see what went into it. The record should include documentation of the alleged violation, a description of the investigative process, copies of the interview notes and key documents, a log of witnesses interviewed and the documents reviewed, the results of the investigation, and any disciplinary action taken or corrective action that was taken or implemented. These can many times result in legal processes, and so any legal counsel who is a part of this process would want those notes, would want to see what we've done and what we've put in place, especially if something has reoccurred. So when we're looking at conducting this internal investigation process, it's really important that we look at the elements that went into it. The condition, what happened, when and how did it happen, and why did it happen? What was this root cause process, and who was involved in the process? We want to escalate when things are appropriate so that compliance issues can be addressed, and those will vary in type and complexity, and they may pose a high risk to our organization, or they may be low risk, but this process is really the same throughout the investigation. We want to have a risk rating or methodology that will show us when processes need to be escalated, and that needs to be part of our policy and our process around investigations. We want to spell out within our program especially anybody affiliated with CMS and our program guidance. This will facilitate the issues resolution in an organized manner. So saying these are the steps we're going to go through as we look at the process, to know that everyone's following the same process is really important. We want to look at high risk compliance issues and what warrants an escalation to either a legal counsel or a business line manager, and heighten that so that it gets prompt attention. And then issues in these categories are usually those that have an expectation where the claim is going to require litigation. It's a repeat issue. It continues to recur. Maybe there's a whistleblower, a report involved, or a violation of the law, or risk related to regulatory fines. Those are just a few of the things that could occur. We want to look at the criteria. Did the issue violate some kind of consumer protection law or regulation, or some other kind of law or regulation that has given us guidance as to what we should be doing? Did it have an unfair, deceptive, or abusive impact on our customers, maybe on our internal customers, which may be our employees or our contractors? What was the cause? What was the source of this issue? Did it happen because of a faulty process or a system failure? Was there an inadequate policy or procedure? Do we have lax implementation of our processes? Was there an execution failure within the organization? So it's important that as we put these in place, we're also monitoring to ensure that all these things did not occur and that we can look at them. Did we have poor training in place? Do we need to go back and retrain? Was there someone who was missed as a part of the training? In the case of contractors, were they included in the process? Excuse me. Deficit monitoring. That's part of our monitoring process. Many times we'll see that as a part of our QAPI process as well. Those ongoing monitoring processes, they may just happen within an individual department. Was there negligence involved? Was there malicious intent, or was it just something that occurred that had no malicious intent related to that? And then what was the effect? Was there a potential impact of this issue? Who and how many customers or employees were involved? Did the customers or patients suffer financial harm, or was there patient care issues related to this? Do we need to know what all the effect was across our entire organization? What was the period of time this issue was active? Has this been happening over a long period of time, or was this something that just happened once or twice, but it had a big impact? It's important to know those things as well. And then what's the potential regulatory involvement or fines or things that could happen from this? This may raise things to a really high issue within our organization, high risk issue. And so they may need very quick response, and we may need to make sure that our education and our processes are really conveyed across a very large audience. And then based on recommendations or the information gathering, what is the recommendation to stop this issue from occurring and to prevent it from happening again in the future? So when we look at implementing corrective action initiatives, this is once sufficient and credible information is gathered to determine the nature of misconduct. It should take prompt corrective action. So when something comes to our attention, regardless of how important it is, of course we want to give it prompt attention. But this could also include things like refunding of overpayments. If it's a HIPAA violation, it may require that we do governmental reporting and that we put credit monitoring in place. We want to be sure that we're enforcing our disciplinary policies and procedures. Did this happen because of a failure within our organization to enforce our own internal policies? Do we have a policy in place, or do we need to make a policy or procedure that shows changes that are necessary to prevent a reoccurrence or misconduct? And do we need to notify appropriate governmental authorities of this misconduct? And we talked about that. HIPAA is a really good example of where we see things come out all the time from the federal government of where privacy and security has become an issue and there was governmental reporting required. We want to be sure also that if we need to, we consult counsel. It's really important in many of these situations that they are involved and that we have legal representation. So when we're implementing corrective action, we really want to look at the compliance officer and should also determine whether the conduct exposed any compliance weaknesses within the organization that should place the entity at risk for others or unrelated misconduct. We talked about that in the previous slide. Are there going to be items that happened that other governmental entities are going to come in? They're going to look at our processes. Are we going to be put under a CIA because of this? And then we're going to have monitoring in place. Or is it an internal issue that we need to monitor ourselves internally, and we need to be sure that we have corrective action in place so that this doesn't occur again? The compliance committee should ensure that the entity takes the necessary steps to prevent recurrence of the misconduct and to strengthen any identified areas of vulnerability. That's where it's important that we have around that compliance committee stakeholders across the organization who can really put corrective actions in place and know what all can be affected by the issues at hand.
Okay, thanks, Lori. I just wanted to also comment on the recommendation to use counsel. It is important, and I know we've previously said this as well, to ensure that counsel that you are utilizing are experienced in not only compliance and government audits, but also in your industry. So home health, hospice, really to have that experience to be able to help navigate the challenges, especially when it's a federal audit. For CP6 is our standard CHAP standard related to compliance. This is the final standard. It's out of order from when we presented, but this is the final standard we're presenting regarding investigation, corrective action, and periodic reviews. It is the finding that correlates with this element. So in this case, again, we look to see that your organization documents the investigation of any identified compliance issues and implementation of corrective action, as well as periodic review. Again, this is evidence where your organization has implemented processes or investigative processes and corrective compliance related to identified compliance issues or prioritized, if there's prioritized risks that are identified that need to be further investigated and there are findings. We will review the documentation of your investigation of compliance issues and the implementation of that corrective action in your process for periodic review, as well as interviewing the compliance officer, as well as staff to be able to assess the effectiveness of the investigative process and what your next steps were in terms of follow-up based on those findings. This is where your own compliance committee documentation, investigation documentation comes into play, and also if you have your compliance program evaluated by an external entity. And some organizations have the compliance program evaluated annually for effectiveness. And in that documentation, we often will also see the summary of the compliance investigations and restitution or corrective action. With the only other component, that piece I wanted to say here also addresses periodic review. So this is just like quality. In terms of frequency, depending on the scope and the length of the corrective action, you want to make sure that you scale when you get to a level of compliance as determined by your organization. You may scale back the frequency or the lens or the scope of that audit, but monitoring it ongoing. So in other words, you may be reviewing documentation weekly or daily as part of your immediate corrective action. And once you receive a certain level of compliance, let's just say, 100% or 95%, depending on the need, Lori would say 100, then you want to make sure that you then periodically continue that monitoring on a regular basis. So it doesn't drop off, but you also don't necessarily continue that level of frequency of audit once you have achieved threshold of compliance. With that, we'll take a look at the final slides here. As we wrap up, I personally am surprised that we've reached the conclusion of all 4 of our sessions. So these next slides are similar to what has previously been presented. They're recaps because they are extremely important. Make sure that you are establishing that culture of compliance. It must be a culture, part of your ongoing culture of your organization, and it is a collective responsibility of all teams to uphold these compliance standards and understand their role in compliance. Make sure that all staff and management and leadership and board are accountable. And as we said back at the beginning, the OIG does remind folks that just because your competitor is doing something doesn't mean you can or should. So it is up to your organization to make sure that you are ensuring compliance within your own organization. Next slide. Just again, develop and implement a corporate compliance program and plan. and using that OIG guidance, I believe, through these 4 sessions, we have, and specific Lori and Deb have really provided detailed information on compliance plans and programs, and the 7 elements and what you will consider, both from a regulatory or a OIG guidance perspective, but also operational perspective. And make sure that you also are developing that audit plan and monitoring plan and compliance effectiveness and risk assessment as we have, as has been presented here. Next slide. We want to make sure that we're training staff and managers regarding the corporate compliance program on orientation and at least annually. And I would add here, when Lori talked about, or Lori and Deb talked about policies and procedures, and Deb is correct, at least annually, reviewing policies. Equally important is ensuring that your staff understand and know your policies as it relates to their role, and that you are implementing policies, implementing operations in accordance with your policies. So you want to make sure that you're not only reviewing the policies, but that the staff receive education, they understand the policies, any changes, and the operational implementation.
Yeah. And the importance of, if they don't know the policies, if somebody asks them a question, they know where to get them, right? So they know where those policies are located. They know how to get their hands on those policies, whether they're electronic or in a book, and they can go and get that information. Always important.
If an evaluation is done of your compliance program, it is across the entire entity. So it's important to understand that if someone comes in to evaluate your compliance program, they are not going to just talk to management. They're going to talk to people at every level of the organization.
Yeah, excellent points. And again, make sure that you are communicating and sharing your overall compliance program audit and monitoring results, your program itself, and those key risk areas with your organization, so that the staff are aware of what those priorities are within the organization. And again, implementation of your compliance program and plan should be an ongoing agency-wide effort. We will, as we wrap up, again, the Sam Rayburn quote, thank you, Deb, for adding, readiness for opportunity makes for success. Opportunity often comes by accident, and readiness never does. And this applies to all aspects of our presentation on compliance, on regulatory, as well as on quality. But you want to really make sure that you do have a proactive approach to compliance. I do want to take a moment to say thank you to our team, specifically Lori and Deb and Nick, and all the SimiTree and CHAP folks behind the scenes that have created this. This has been, I will say this, a labor of love with all of us, with this, recognizing the importance of compliance from both of our organizations. It took us, I believe, a year to be able to, or almost a year to be able to make this, pull this together and make this a meaningful program for all of you. And thank you to all participants. We do hope that you have found this information informative and meaningful. You are able to get to obtain these recordings, as Deb said, on YouTube. You can just look up SimiTree and CHAP. And we have provided through the four sessions, I believe, a wealth of resources that you can utilize to be able to implement an effective program. And with that, we can look to see if
we have lots of questions.
Can you go to the next slide? Because I do want to make sure that everybody has the QR code. This is the code that you're going to want to scan to be able to complete your evaluation. And we will have this up while we're looking at questions.
Yeah, and more importantly, get your CEUs. Yeah.
Yes.
There
right?
you go. Yes, thank you.
There you go. So the first question we have is from Eugenia Smither, and it talked about, it asks, You are correct around the focus on month-to-month monitoring. Is there guidance on how to address the ebb and flow of terminality and how to assist in documentation? Lori, I think we talk about this more with clients all of the time, right? Because it did go from that benefit period to now month to month. So Lori, what's your thoughts on how to deal with that ebb and flow of the terminality of a hospice patient?
Well, first of all, glad to see you here, Eugenia. Also, I think the most important thing of what we hear is that you want to be able to show that there's decline, some type of ongoing decline. Now, it may not be day to day, week to week, but between your billing periods that you are documenting to change in that patient. That's really what they're looking for. And that's based on the LCDs and the requirements within the LCDs. Now, we know the LCDs are recommendations according to the document. However, what we're seeing is that they're really being used as guidance for recommendations and requirements to help the auditors determine what would substantiate change in that patient based upon their disease process.
In the objective measurement, right? They're
Absolutely.
looking
Quantifiable objective measures.
Objective data.
Absolutely.
Yep, for sure.
So get rid of those subjective terms within your documentation and really use that.
Yes.
Here's what your weight was. Here's what it is now.
Yes, absolutely.
Yep.
Our next question comes from Lindsay Jones, and there's actually a two-part because an anonymous person chimed in on the second half of it. But are there any mock survey kits available for use in hospice? And somebody asked the same question for home health services. So Kim,
Yep.
Do you have thoughts on that?
Sure, I do. First of all, depending on who your AO is, you may have some guidance related to an accrediting organization as far as specific components such as document request list or policy lists. However, actual assistance or kits with mock survey, you want to really look at expert consultants. CHAP is one. I know I can speak for CHAP that we have certified consultants listed on our website. They are not CHAP employees, and they're separate from CHAP, but they are trained in certainly survey readiness and CHAP standards. And they typically we find that consulting firms will have tools to be able to, and guidance and support to be able to help an organization with survey readiness, as well as plan of correction follow-up if needed. And that would be for both home health and hospice. I know that for hospice, for NHPCO, there was a survey readiness resource that was developed. And I also believe that now that it's the National Alliance for Healthcare at Home, or for Care at Home, I don't know what the status is with that resource, but I'm sure that the National Alliance will be able to provide input on that. In addition, there are state associations that have also done a tremendous job with survey guidance and resources. So that's really where you're going to find that information. It's a great question.
Great. We've got another one from Eugenia. She came back and asked the second question. When you survey for compliance training, is that addressed during your compliance review or the general training, education, competency, HR file review? So I think that may need a little bit more clarification. I've read it a couple times. So when you survey for compliance training, is that addressed during your compliance review or the general training, education, competency, HR file review?
So I think I understand what the question is. It's where do we look for, at what standard will we look for evidence of compliance training? We will look for the evidence of that training wherever the organization indicates that evidence occurs. And most often it's in the in-service, orientation and in-service documentation and personnel records, and but sometimes it might be separate. So the organization defines for us what their policy and what their processes are and requirements for training, for orientation and ongoing training, frequency, content, etc. And then we would evaluate to where the organization can demonstrate they have that information. I just also want to back up on the other question about mock survey. Again, I can speak for CHAP that we do have our Center for Excellence. Learning Solutions has outstanding programs in terms of to assist with accreditation and intensives and also survey readiness. Again, not kits, but additional training, really expert training.
And I want to just address that really quickly as well, Kim. I think that question really goes to the things that we talked about throughout this, which is auditing versus monitoring. You are going to understand internally when you're doing your own monitoring and a mock survey with your own people, where things are and things like that, versus when you have someone else come in and that's an outside set of eyes, which is more similar to what the survey process actually is. I think it gives you some area of insight that you wouldn't necessarily get when you're doing your own internal monitoring. So I think that's important.
Yeah, you label things differently, you ask for things differently, and your staff may not relate to those until a surveyor is on site, and then you're scrambling to figure that out. Agree.
Absolutely.
Next question. I'm not sure that we can answer it here, but we're going to go through this. It's from Ashley Anderson. In terms of documentation, this pertains to HOPE specifically. However, what do you do in a case where SFV was completed but not signed by the LPN because the LPN was terminated? The LPN that was terminated performed the visit. Should the agency have a new LPN conduct the visit again to document, or can someone else redo the documentation and sign it? Also, this would then mean the SFV would be late. As per CMS, these should be completed within 2 days after comprehensive HUV1 and 2, if applicable. Or would you recommend that they move forward with identifying that one was not completed and provide a reason in the documentation and take HOPE out of the equation? I believe it would have a new nurse conduct the visit again and document. Unique circumstances here. Thank you. So there's a lot there.
Yeah, you're going to have to reach out to your MAC or to the HOPE Health Center for that. It's really outside the scope of this.
Yeah, very much so. And then the last question. Oh, sorry, Kim.
Oh no, is that the last? Okay, because
I've got one.
We have two more.
Yep. Yeah, I've got one more or two more maybe. Maybe a couple more.
Yes. Yeah. So we can step through. Yeah.
Yep. So in making PRN visits and care planning, unrelated diagnoses considered part of medical necessity that CMS is looking for. It sounds like hospice, unrelated diagnosis, or I guess it could be home health as well, unrelated diagnoses. Are they considered medically necessary? I think it depends, right? I think depends on what you're making that PRN visit for. Is it related to your care plan? Is it a skill that you're providing? Kim, Lori, anything additional on that? It's kind of a pretty vague.
Well, I would just say that for hospice, you're responsible to care plan to everything, regardless of whether it's related.
Right. And in home health, we're care planning to what we're doing, right?
Yep.
So it really depends on the circumstance. Is it acceptable to have the compliance committee share with another committee as long as the charter is clear what the compliance pieces are for? What the compliance pieces are, for example, at the board level, a compliance and audit and finance committee or a quality and compliance committee?
No, I mean, there's nothing that says you can't. You just want to be sure that when you're developing your risk assessment for compliance, it's very clear what the objectives are within your compliance risk assessment versus maybe an auditing plan within the organization. The auditing plan may be a part of the process, but you want to separate those pieces.
Yeah, I would also add that there may be members of the compliance committee that are not on, on the quality committee or another committee. So you may have some some sort of changing out, if you will, of, for like billing representative or, finance representative that may not be on the quality committee, whatever the process is within your organization. So you can have essentially the same committee, but you do want to make sure that you have appropriate representation. Did I say that correctly, Lori?
Yes, yes. You want to have the stakeholders, around that table.
Yeah.
Yep. Andrea Sullivan's asking, is there a place to find a compliance risk assessment template?
Oh, there are lots out there. If you just Google compliance risk assessment, you'll have more come up than you want to see.
And
Plus-
obviously,
plus in
though,
our-
make sure it's from an organization that's trustworthy. as
Yeah,
Well,
well,
I was
and
also gonna, oh, go ahead, Laura.
I was just going to say, and there are different types. So
Yes.
depending on your industry. So you want to make sure that you're looking for one within your type of industry. Go ahead, Kim.
Also, well, throughout our presentations, I do believe that we have some links that have been shared through OIG guidance for information regarding risk assessments. So not, to be able to provide some information there.
And Susanna would like some information. Where is the manual CHAP standard CP6? Is that separately obtained? Can you share, please? Or CP.5? Where is that found?
Yeah. So the way for CHAP standards, current standards, you can go to our CHAP website, CHAP Inc. CHAPinc.org, and look under standards, and you will be directed to our standards monitor. On that page are all of our standards for all of our service lines, and compliance standards are embedded in, for example, our home health and hospice. Most of our service lines have compliance standards embedded. So if you download our standards, you will see the standards themselves, as well as the evidence to review. And in these presentations, the last two, this 1 and 3, we also have the reference to the compliance standards themselves.
Michael would like to know, for a new compliance director, in your experience, is the HCCA Academy or Annual Institute a better place to start? Well,
It's a great place.
They're both,
it's
both
a
pretty good.
really great place to start. Healthcare Compliance Association, because they're going to give you the process, the outline. You're going to really learn what is included and what's required within a compliance process and a compliance program, how to develop a risk assessment, all those pieces. So I tend to recommend them.
And with that, I just want to, I don't know if we have any more questions, we can follow up separately, but this program will end automatically in less than 2 minutes. So
Yep.
I do want to make sure that, that we've had a chance to answer as many questions as we can. We just really hope that that you found this information, again, informative and meaningful, and provided you with strategies that you can utilize within your own organization in developing a comprehensive and effective compliance program.
Do you have any more questions, Deb?
There's one left. Are we correct in our understanding that if an opioid was initiated before the HUV or SFV visit, then that is the date we enter, the initiation date, and not the HUV or SFV date visit? Kim, thinking maybe that might be something related to CHAP, but not sure, for med profile potentially.
Or hope.
Or hope,
that,
yeah.
Yeah, so I think that's outside really the scope of this presentation.
Mm-hmm.
And that's our last question.
Thank you all.
Thank you, everybody.
Yeah,
Thank you
it was
very
great.
much. Thanks, Deb and Lori.
Thanks, Kim and Lori. It's always great to work